Hey everyone, and welcome to Look Who's Tokin with Todd Chuck. I'm your host, the Todd. This being RANN's first ever mind-altering substances news segment, I figured we'd start ourselves with a softball. Heroin.
Tonight on Chronicle, an epidemic is gripping Pennsylvania.
It's never been this bad.
More people are using heroin than ever before.
The rate of heroin overdoses has risen 5 times in the last 10 years. And since Mitch Hedberg died, it's not even the cool kids doing it. It's become a mostly suburban and rural problem, which may explain why everyone is so flippant about a surge in deaths because of heroin abuse. ABC News' coverage began with, "The mountains of Colorado and Vermont have long drawn skiers, hikers, and nature lovers. Lately, an unwelcome guest has been showing up more and more in these pastoral settings. Heroin." Just like people who go into nature for fun, however, heroin usually inspires little sympathy, attraction, or compassion from those who don't partake. We, as a society, look at heroin addiction as a weakness, not as a health issue. And so we treat heroin addiction as a criminal problem, not one of public policy. Of course, this is how we treat all drugs and drug addicts in this country. We do wage a war on our own citizens who are committing victimless crimes, only to be turned up and spit out by a slave-like prison industrial complex that unfairly targets black... But even if you don't think that drugs like heroin should be legal, you have to admit that our attitudes towards the drug aren't working if 5 times the number of people have died as 10 years ago. But in the small town of Ithaca, New York, an oasis of lakes and hills tucked deep into the countryside, a young mayor has promised an alternative to simply jailing addicts.
28-year-old Ithaca Mayor Svante Myrick is asking the state health department to approve a heroin clinic where medical professionals would watch as addicts shoot up, standing at the ready to intervene if someone should overdose. The mayor says such clinics have worked in Canada and Europe to prevent addicts from shooting up alone, where no one would be able to help them should they overdose.
The most talked about piece, the clinic where heroin users are safely monitored while they shoot up, is based off a model in Vancouver that has administered 2 million injections without a single overdose. And for you heartless capitalists out there, it's even saved the government money. This, however, may not be enough to help young Ithacan Mayor Svante Myrick as he tries to push his plan through the state legislation. Svante, and I believe he would grant us a first-name basis, has stated that he plans to urge the New York Department of Health to consider the heroin epidemic a crisis, which would allow him to administer aid without state legislation. This, however, still does not stop the federal government from stepping in under Title 21 of the Controlled Substances Act, my favorite congressional document with which to wipe my anus. It should be noted, however, that Svante is unveiling this as part of a greater 4-part plan aimed at prevention, treatment, law enforcement, and harm reduction. And other states, using models like lower sentencing laws in Seattle, legalized pot in Colorado, Washington, and others, have shown that we just need a federal government willing to look the other way while a radical and potentially life-saving experiment is underway. The good thing, however, is that no matter what happens, at least we're talking about it. It wasn't long ago that a plan like this was tantamount to blowing a communist in Cuba. And, as the New York Times notes, places like Ithaca have proven we found a more forgiving approach to addiction, a stark contrast from the response to crack cocaine in the 1980s and 90s. We've made a lot of progress as a society towards an open and loving relationship with mind-altering substances, and I think it shows how far we've come as a nation, together. Oh no, it's just because we're racist. I gotta go do some drugs. So what does Dr. Chuck think about heroin? Honestly, I thought as a society we'd given up on this drug 20 years ago. But clearly some people haven't. So if you or someone you love uses heroin, urge them to use clean needles, and urge your own state lawmakers to find a way to stop putting addicts behind bars and find ways to treat them. And if you haven't done heroin, don't start that shit. This has been Look Who's Tokin with Todd Chuck. And for heroin, my recommendation, just smoke weed instead.